So to start us off, could you tell us what is diabetes and how it can impact our health?
So diabetes is a chronic disease that is characterized by having high sugar levels in the blood. And when you have high sugar levels in the blood for a long period of time, then it can start to stick to things it's not supposed to stick to and potentially cause problems in the body, such as effects on the eyes, effects on the heart, effects on the kidneys, effects on the legs and the nerves and other parts of the body. So that, in a nutshell, is what diabetes is.
Can you tell us what are some common symptoms of diabetes?
So the most common symptom of diabetes is no symptom at all, which is why it's so important that people are watching this video so that they know to ask their doctor to get blood tests done on a regular basis. So the most common symptom is nothing. But if the blood sugars start to get higher, then one can start to develop symptoms. So those symptoms are things like going to the bathroom all the time to pee, being super thirsty, maybe blurry vision. And then if someone also starts losing weight unintentionally with those symptoms, then they should definitely seek attention right away. But the most common symptom, like I said, is absolutely no symptoms, which is why regular screening with your doctor is so important.
What does it mean to have prediabetes, and can this be reversed?
So the thing about diagnosing diabetes is it's based on blood tests, and there's a certain threshold number that we look at. It's either a fasting blood test or another kind of blood test that you can have ordered. However, it's not a black and white situation. It really is a slow progression over time. So therefore, someone can have prediabetes, which means the sugars are a little bit high, but not quite reaching the threshold of what is considered diabetes. So when the sugars are a little bit high, then that's what we call prediabetes. It's almost like sitting in the waiting room, waiting to go into the diabetes room. Now, can it be reversed? Well, it depends on the type of diabetes that one is about to develop. So if they're progressing towards what we call type 2 diabetes, then sometimes there is a possibility to reverse things by altering the diet, perhaps adding some physical activity, and maybe changing the body weight. But if they're destined to develop type 1 diabetes and there's still a phase of sort of slightly high sugars, then in that situation, no, reversal would not be possible.
What are some ways to regulate blood sugar?
So the ways to regulate blood sugar are to think about non-drug related, what we call non-pharmacologic things, or things that are related to medications. So the things that one can do to regulate blood sugars that do not involve medications would be things like food choices. So all foods are considered good foods, but it's a matter of how much and how often one takes the food. So specific to blood sugars, it's the carbohydrates. So it's the things like bread, pasta, noodles, roti, chapati, cereals. It's those starchy things are the things that can raise blood sugar. Whereas things like protein, which you find in things like meats and fish and tofu, those can blunt the blood sugar rise. So food is one part of it, but another really important part of it is movement. Notice I didn't say the word exercise because people then think they have to run a marathon. I'm just talking movement. So movement, if you can move after you eat, then it helps to burn those sugars or to put those sugars away from the food that you've consumed. And then of course some people will require medication, which is just another tool in the toolbox in order to control the sugars in the blood.
What is one myth about diabetes you'd like to debunk?
There are many myths I'd like to debunk, but if I had to pick just one myth, I'd like to debunk the myth that people with type 2 diabetes developed it because it was their fault. Because shaming and blaming is huge in the type 2 diabetes space. When someone's diagnosed with type 2 diabetes, it often comes with a sense of guilt. People around them will say things like, I told you so, or I told you not to eat that cake, and I told you this, and I told you that. But that's really not fair, because the biggest predictor of whether or not someone's going to develop type 2 diabetes is actually genetics. We can't change that. We can't change our genetics. We can't change the family in which we were born. What we can do is maybe slow down that progression, and that's where lifestyle can play a role. But I really want to debunk that myth that someone got type 2 diabetes because they were lazy or they didn't do the things they were asked to do. That's totally not fair and not true.
And lastly, a fun question. What is your favorite way to beat the heat in the summer?
My favorite way to beat the heat in the summer, this is perhaps not the best public service message, but for me it's actually a nice cold beer after a round of golf would actually be my favorite way to do it. It could be a non-alcoholic beer, but the point is just a nice cold beverage after some activity outside.
Amazing. Thank you so much.
Thank you.